If you've been dealing with ongoing symptoms for years, seen multiple doctors, tried different treatments, and you're still not where you want to be, today I want to introduce something I would seriously consider much earlier if I were starting over: intravenous cannabinoids, often referred to as PICO IV, because what I've seen over the years is that when you begin to understand how this system in the body actually works, you start to see possibilities that most conventional approaches completely overlook. And once you see it, you can't really unsee it. And that raises an important question. Hi, I'm Dr. Fred Bloem. I'm an integrative and holistic physician, and on this channel we talk about complex chronic illness, root causes, and how to actually move forward when things haven't worked the way you expected. If you find this helpful, go ahead and like, subscribe, and feel free to comment as we go. I read them. What I want to talk about today is something that is still very misunderstood, even among physicians, and that is the endocannabinoid system. Most patients I see have never heard of it. Many doctors were never trained in it, and yet it is one of the most important regulatory systems in the human body. That's not an exaggeration. This system is connected to essentially every major system: neurologic, immune, hormonal, digestive, and its job is very simple: maintain balance, maintain stability, maintain what we call homeostasis. Now here's where it becomes clinically interesting. If you've been dealing with persistent symptoms, not one symptom, but a pattern, fatigue, poor recovery, inconsistent function, things that don't quite make sense together, very often what I see is not just a single problem, it's a loss of regulation. And that's where this system comes in. Because the endocannabinoid system is not just another pathway, it's more like the system that helps coordinate all the other systems. And when that system is not functioning optimally, things start to drift. Slowly at first, then more noticeably, and eventually you end up in a situation where everything feels off. But nothing is clearly wrong enough on standard testing, which is exactly where many of my patients find themselves. Now here's the part that most people don't realize. Your body already produces its own cannabinoids. You've had them since before you were born. They are essential for development, regulation, and survival. So this is not something foreign. This is something foundational. And when that system becomes depleted, dysregulated, or simply not functioning efficiently, the body loses some of its ability to self-correct. And that's where the concept of supporting that system starts to make sense. This is where PICO IV comes in. And I want to be very clear here. This is not about recreational use. This is not about getting high. The formulations used in this context are non-psychoactive cannabinoids. What we're talking about is using plant-derived compounds to interact with a system that already exists in your body, to support regulation, to support balance, to support the body's ability to do what it's designed to do. Now why intravenous? Because route matters. When something is taken orally, it goes through digestion, metabolism, and there's variability. When something is administered intravenously, it becomes more direct, more controlled, and more predictable. And clinically, what I pay attention to is not just what something does in theory, but what patterns I see over time. And what I've seen is that when this system is supported appropriately, patients often describe something interesting. Not dramatic, not extreme, but noticeable. They feel more regulated, more stable, more like themselves. And that's a phrase I hear often. Let's go a little deeper, because this is where the pattern recognition becomes important. The endocannabinoid system works through receptors distributed throughout the body, and these receptors influence multiple pathways simultaneously. So instead of targeting one pathway, you're influencing a network. And when you combine multiple cannabinoids together, CBD, CBG, CBN, and others, you create what's called an entourage effect, meaning they work together across different pathways at the same time. That's very different from most conventional approaches, which tend to be single target. And that difference matters, because complex problems often require multi-system regulation, not single-point intervention. Another pattern I've noticed is that many patients who have been struggling for years are not necessarily missing one thing. They are missing coordination. Their systems are not communicating efficiently. Their recovery is inconsistent. Their responses are unpredictable. And when you start supporting regulatory systems instead of chasing individual symptoms, you sometimes see a shift. Not overnight, but gradually, and importantly, more sustainably. Now I want to be careful here because this is not for everyone, and this is not something I would apply universally. So let's talk about who should pay attention. If you're someone who has tried multiple approaches and things helped a little but didn't fully resolve, if your symptoms seem to involve multiple systems rather than one isolated issue, if you've been told your labs are normal but you don't feel normal, then this is something that may be worth understanding. Not necessarily jumping into, but understanding. On the other hand, if someone is doing well, stable, recovering appropriately, this may not be necessary, and that's important, because good medicine is not about doing everything. It's about doing the right thing for the right person at the right time. There's also nuance here. This is still an evolving area. There's still education needed, even among practitioners. There are still misconceptions. One of the biggest being that anything related to cannabinoids is automatically recreational or psychoactive. That's simply not accurate. And that misunderstanding has slowed down progress in this area. Another important point. This is not a replacement for everything else. This is not a shortcut. This is not a standalone solution. It's one piece of a larger strategy. And when used appropriately, it can complement other approaches by improving regulation, which then allows other therapies to work more effectively. If I look back at how I approached patients earlier in my career, I focused more on individual problems, infections, toxins, hormones, and those are still important. But what I've learned over time is that unless the system as a whole can regulate, you can correct individual pieces and still not get the result you're looking for. And that's one of the reasons this topic matters, because it shifts the focus from fixing parts to restoring coordination. So the takeaway here is not that this is the answer. The takeaway is that this is a system that most people have never been taught about, that plays a central role in how the body maintains balance, and that can be supported in ways that are very different from what most patients have experienced. And I'll leave you with a few questions. Has anyone ever explained the endocannabinoid system to you in this way? Does this idea of regulation versus symptom treatment match your experience so far? And would you want me to go deeper into how this fits into a full treatment strategy? Because for many people I see, this is the moment where things start to make more sense. Not because it's complicated, but because it connects the dots in a different way.